Living well is the central core of a healthy, fulfilling life. By understanding about obesity, taking care of ourselves physically and mentally, and learning a few tools towards physical activity, we can achieve a healthy balance in our lives. In this module, we'll discuss the complex and chronic nature of obesity. We'll talk about taking charge, ensuring we are active participants in our own health, and we'll review a number of physical activity tools to help in our journey towards a healthier lifestyle. Let's start with obesity. What do we mean when we use the term obesity? Obesity is characterized by excess body fat that can threaten or affect our health, and it can make pre-existing medical conditions more difficult to manage. We might be surprised to discover that it's not just about what we eat and how much we move. A chronic disease generally develops over time, it's long-lasting, and often there is no cure, but can be treated. In recent years, obesity has been recognized as a chronic disease by the World Health Organization and the Canadian Medical Association. Other chronic diseases include heart disease, arthritis, and diabetes. Because obesity is considered a chronic disease, managing it is a lifelong process. We've learned that managing obesity can be quite complex. There are many factors that influence weight, and it's normal to have competing priorities in your life. But being aware of those factors in our lives which may affect our weight helps create the ability to put a plan in place. Here are a few factors to consider. Stress. Stress is a fact of life for many of us. Healthy eating habits can be difficult to maintain when you are experiencing stress. Sometimes we make poor food choices due to convenience or to fill an emotional need. This is just one factor that stress may have on weight. Ultimately, a lifestyle with chronic stress is rarely a healthy lifestyle. Money. Money is another factor. Investing in your health does not have to cost big bucks. There are plenty of economical ways to incorporate activity into our lives and small changes we can make in our diet that aren't hard on the wallet. Sleep. Lack of sleep is another powerful factor. When you don't get enough sleep, it can affect our alertness, energy levels, and the ability to participate in regular physical activity. When tired, we often don't feel like cooking and sometimes rely on convenience foods. Chronic conditions. Related chronic conditions are sometimes an important factor. Often, the presence of chronic conditions or the treatment for the symptoms of a chronic condition can contribute to further weight gain. Taking better care of ourselves can start with a doctor's visit. Regular checkups with your healthcare provider are one of the best ways to stay healthy. Health exams and tests can help to find problems early when the chances for effective treatment or even a cure are better. We can help manage our care at home as well. If you have diabetes, be sure to check your blood sugars on a regular basis. If you have high blood pressure, monitor your blood pressure on a regular basis. If you have high cholesterol, check in with your care provider to help find the best ways to manage it. And the management of chronic disease requires regular follow-ups and self-care. Oftentimes, we have prescription medications as part of our treatment plans. Taking your medications as prescribed will ensure you are in the best possible medical health. Let's ensure that we are all active participants in our health and well-being. We don't need to be medical professionals to be involved in our own care. Being informed patients allows us to better prepare, ask important questions, and better understand our health conditions. If you don't understand something, be sure to ask. What is physical activity? It's any activity that gets you moving. This includes activities such as cleaning your house, walking to work, doing chores, playing with your kids, or something more intense like power walking, swimming, or biking. Being active is important for everyone, not just people who are trying to lose weight, and the benefits abound. Physical activity helps reduce the risk of heart disease. It helps lower high blood pressure, it lowers the risk of type 2 diabetes, and it may reduce the need for some medications. It leads to improved fitness, strength, and stamina. And it often improves our mental health and our mood. Along with increased energy, improved sleep comes naturally. We all understand that increasing our physical activity is not without challenges. Even when we understand the benefits of physical activity, it is sometimes difficult to soldier through. So here we'll present a few common challenges that may occur and some helpful tips to use to overcome them. I hurt after exercise. After exercising, it is common to feel stiff and sore the following day. This is an effect called delayed onset of muscle soreness, which is normal and expected. This soreness will last for about 24 to 48 hours after a new activity. There are ways to decrease muscle soreness, such as starting off slow, staying within your limits, or taking a day off in between workouts. I don't have a gym membership. If you live in a small community or on a farm, you can still work activity into your day even though you may not have access to a gym for a workout or a pool in the summer. There are plenty of ways to work activity into your daily life. Get a group of people together to walk in the gymnasium at a school or around the town or down a path on the farm. Try a fitness video at home, and you can use common household items as exercise helpers, such as cans of soup, a chair, laundry or milk jugs filled with water, stairs, and step stools. Exercise takes so much time. There are many ways to fit in a bit of exercise just as you do other appointments. You need to schedule exercise into your day. If you are unable to do a full workout, you can always divide up your workouts into 2 or more separate sessions. That's just as beneficial as one session. Even 10 minutes of exercise can make a difference, and an hour of exercise is only 4% of your day. Find ways to be active on work days, such as walking on breaks, or even walking to work, or parking further away. Be active at home. Activities like walking to get the mail, climbing the stairs a couple of times while you are waiting for supper to cook, or taking your dog for a walk. Getting motivated is hard. Low motivation and avoiding exercise can delay you in starting to increase your fitness level. If you wait until your motivation is high, you could be waiting a while. Starting an exercise routine may help boost your energy level and in turn may boost your motivation level. After as little as a week of consistent exercise, you'll start to feel better, so why not give it a try? Set goals that are small, reasonable, and attainable. Start off with something small every day, like going for a 10-minute walk. Track your activity on a calendar or fitness app so you can see what you are accomplishing. Then reward yourself after you've kept on track for a week, like going for a manicure or massage. I feel tired all the time. If you find yourself too tired to exercise during the day, then make a plan to fit in exercise at a time when you feel rested. Finding a routine that works for you is important, so schedule activity into your daily routine when it best suits you and you feel most rested. If you are too tired to exercise after work, then go for a walk during your morning break. Remember that all you need to start with is 10 minutes a day. I don't like to exercise. When starting a new exercise routine, it may feel a bit hard at first, but if you stick with it, you will get stronger and feel better. Be sure to choose an activity that you enjoy doing and that fits into your lifestyle. Join a group fitness class, do online workout videos, or simply go for a walk during some downtime. It's hard to stay committed to an activity plan. A common problem with staying committed to an exercise routine is starting off with too much at the start. It's best to gradually work up to more days and times slowly so you don't feel exhausted. Some folks get bored of the same exercises and don't know what to do next. Change up your workouts often and find a friend to come along with you. Don't be discouraged if you miss a day. A little physical activity is always better than nothing. Please remember to consult your family physician prior to starting any physical activity. They can offer you guidance on the types and quantities of activity best for your circumstance. It's easy to get started with your physical activity plan. Here's how. Pick something you like to do, like walking the dog, swimming, or aquasize. Start small. 10 minutes of a light activity goes a long way. Short sessions are great, but should be frequent and can be completed multiple times a day. Every little bit counts. Make physical activity a part of your routine and schedule your activity with friends. Crack a sweat together. Always keep hydrated and drink plenty of water. Track your activity for awareness. Keep a journal or logbook and watch your progress. Don't be hard on yourself. Celebrate your wins.